Surprise! It's me! I had a couple questions about what exactly the criteria for MAiD was. So we're going through the criteria. Here's the some of the requirements, right? The criteria, right? So medical assistance in dying, or MAiD, is a process that allows someone who is found eligible to be able to receive assistance from a medical practitioner in ending their life. The Federal Criminal Code of Canada permits this to take place only under very specific circumstances and rules. Anyone requesting this service must meet specific eligibility criteria to receive medical assistance in dying. Any medical practitioner who administers unassisted death to someone must satisfy certain safeguards first. Only medical practitioners are permitted to conduct assessments and to provide medical assistance in dying. This can be a physician or a nurse practitioner where provinces and territories allow. There's the legislation. So if you want to see like the legislation, the laws and stuff like that, former Bill C-7. But let's keep going in here for now. There are two methods of medical assistance in dying available in Canada. Method 1 is a physician or nurse practitioner directly administers a substance that causes death, such as an injection of a drug. This is sometimes called a clinician-administered medical assistance in dying. And method 2, a physician or a nurse practitioner provides or prescribes a drug that the eligible person takes themselves in order to bring about their own death. This is sometimes called self-administered medical assistance in dying. Clinical guidelines and practices outline which drug use, and are established by provinces and territories and organizations that regulate the practice of medicine. So that would be like the Board of Ethics and many of the drugs commonly used for this procedure are already available in Canada. Healthcare providers usually provide them at lower dosage for common purposes such as nausea, pain control, and anesthesia. As the regulator of drug products, Canada Health is working with partners to help support access to the drugs for medical assistance in dying. Eligibility. To be eligible for medical assistance in dying, you must meet all the following criteria. All of it. All of it. So no half this, no part that. You must meet all of it. You must be eligible for health services funded by a province or territory or the federal government. So people from the United States can't like hop the border to come and get suicide medication, all right? Not a thing. You may also be eligible if you meet your province or territory's minimum period of residence or waiting period. So you might be able to apply if you came from abroad and then decided to do that here, but you have to meet the province's requirements for whatever that is. Must be at least 18 years old and mentally competent. So when I gave the example of a 17-year-old earlier, that wouldn't apply. You have to be 18 at minimum to be able to apply. And you have to be mentally competent. So if you are deemed not mentally competent, you would not be able to apply for MAiD. Have a grievous and irremediable medical condition. So you have something that it can't go away, can't be cured. You can't fix this. Make a voluntary request for medical assistance in dying. So you have to make a voluntary request. Something nobody can coerce you. Nobody can just sort of drive you towards that track. Nobody can do it for you. You have to be able to voluntarily do this yourself. Your mom can't do it for you, or a guardian can't do it for you. If you're somebody who needs to have a guardian, you likely do not meet the criteria. The request cannot be the result of outside pressure or influence. Give informed consent to receive medical assistance in dying. Informed consent. So you have to know what you're doing, you have to know what you're signing up for, you have to have all of the da-da-da-da-da-da. Alright? Generally, visitors to Canada are not eligible for medical assistance in dying. Grievous and irremediable medical conditions. There's no reason why a trans person should not be able to apply to this if they wanted to, and then be able to meet the criteria, again, provided they have a grievous and irremediable medical condition, and they're above the age of 18. Right? So there's no reason why anybody from the LGBTQ plus community would be excluded from this, right? Why would you? Why would you exclude somebody like that? That doesn't make any sense. Well, yeah, hyperbole, Dawn is right. Hyperbole would not be, rhetoric and hyperbole are not medical conditions, right? Rhetoric and hyperbole does not inform someone's medical condition. That's why you need a practitioner or a professional to do a diagnosis and an assessment, right? There are some, again, this is also Canada specifically, so there are some things that are available for the trans communities in Canada that aren't available in other countries when it comes to access to medical care for transitioning, where some things are considered voluntary and some things are not, and some things are really expensive and some things are not, and some things you can get subsidies for and some things you can't, right? So that's about balancing. Now, is there an argument to be made that more things should be made accessible to more people easier, and you want to expand those programs? Sure. You can make that argument. So if you want trans people to have easier access to medical care. Yeah, we're continuing yesterday's topic a little bit, because we had a couple questions about what exactly the criteria for MAiD was. So we're going through the criteria. Okay. So grievous and irremediable medical condition. All right. So let's talk about what does that mean, right? To be considered as having a grievous and irremediable medical condition, you must meet all of the following criteria. Have a serious illness, disease, or disability. Be in an advanced state of decline that cannot be reversed. Experience unbearable physical or mental suffering from your illness, disease, disability, or state of decline that cannot be relieved under conditions that you consider acceptable. Also, against the common sense of Western people, cosmetic surgery is actually one of the most reliable ways to increase happiness long term. So I think framing it more like this would substantially increase my quality of life is more accurate. Yeah, I think you're correct about that. There is like in like the United States and Canada, there's like a shy away from cosmetic surgery, but it's not like that everywhere in the world. So like, get good. Like, it's not a big deal. It's not. I don't think it's a problem if people want to get cosmetic surgery, get cosmetic surgery. And if cosmetic surgery is like is going to be taken seriously as a quality of life thing, maybe cosmetic surgery needs to be a little bit more accessible. But because right now the argument, from my understanding, again, maybe I'm a little bit behind on this, but from my understanding, the argument against cosmetic surgery is that it's voluntary and it's not medically required. So we just might need to have a little bit more nuance to that situation. They're not saying that this is a cosmetic thing at all. They keep insisting it's life-saving. Well, something that is cosmetic can be life-saving, but again, you're talking about the difference between rhetoric and like what the medical community or like what the standards are going to be in medicine, right? Which are just going to be different things. Because with MAiD, it seems like a lot of trans people would use the MAiD service. I mean, you can look at the statistics if you want. You can see, like, if you want to look outside of the 95% or whatever the percentage was that we looked at, right? House to yourself, invited someone for anybody. Yeah, I've got the whole house to myself. Time to clean. My aunt by choice got her gender affirming surgery. She's super happy with it. It really improved her mental health. Yeah, good. Western medicine has a model of health that is very reactive. You're left to your own devices until something breaks. Yeah, that's a good point. Yeah, I mean, particularly in the United States. It's not a per capita number. What? It's No, it's of the 20, it's the total number. It's of the total number. It's of the total number of applicants that got MAiD. So, of the total number of applicants that got MAiD that were then removed, and then after you removed the number that were rejected. I'll show you the numbers in a minute. Let's finish this first. So, you need to have these things. These things are required, right? Then you do not need to have a fatal or terminal condition to be eligible. If your only medical condition is a mental illness, you are not eligible for medical assistance in dying until March 17th, 2027. If you have a mental illness along with other medical conditions, you may be eligible. Eligibility is always assessed on an individual basis and takes all relevant circumstances into account. However, you must meet all criteria to be eligible. Informed consent is when you give permission to receive medical assistance in dying after you receive all of the information you need to make your decision. This includes your medical diagnosis, available forms of treatment, available options to relieve suffering, including palliative care. So this is why, like, the quote-unquote hypothetical mistake that we were talking about yesterday is not possible. You have to, it's voluntary, and you have to be made aware of all of these things. And there is an entire process where you get other forms of treatment made available to you. They find different tracks and different options for you. And you have to have done these things, because as you look at up here, you have to have a condition that cannot be fixed. It has to be grievous. And it can't... where's the other one? It can't be relieved under that you consider acceptable. Right? You must be able to give informed consent both at the time of your request and immediately before receiving medical assistance in dying, unless special circumstances apply. So, like, you're unconscious or just, like, whatever the fuck they end up doing. You can withdraw your consent at any time and in any way. I'm kind of curious what the special circumstances are. But, regardless. So, you can pull out whenever you want. There's no consequences. And you have to consent 2 different times. And one of them is right before you get, like, your lethal injection, let's call it. Making a request. Regardless of your location, you can request medical assistance in dying if you are eligible. If you're experiencing a lot of pain and suffering due to your medical situation, talk to your physician or nurse practitioner. You can discuss options related to your circumstances and your possible interest in medical assistance in dying. How and where the service will be offered is determined by medical institutions, provinces and territories, and the organizations that regulate health professionals. You may have to meet other requirements. Your healthcare provider can tell you more. If you don't have a regular practitioner, your province or territory may have a central coordination service that can help you support and resources. The roles of province of blah, 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 blah. Procedural safeguards, right? Before a medical practitioner administers medical assistance in dying, they must satisfy certain safeguards. These include making sure that you, 1, have 2 independent medical assessments, 2, make a written request signed by an independent witness, 3, know that you can withdraw your request at any time. 4, provide final consent before receiving medical assistance in dying. 5, give advance consent if acceptable. Sorry, if applicable. They must also meet extra safeguards in the event that your death is not naturally foreseeable. Medical assessments. When you make your request for medical assistance in dying, 2 independent medical practitioners, physicians or nurse practitioners, must assess it. Your medical practitioner must make sure that you meet all of the listed eligibility criteria. The second practitioner must also provide a written opinion confirming that you are eligible. The medical practitioner providing the original assessment and the one giving the second opinion must be independent. This means they cannot knowingly benefit from your death, hold a position of authority over you, be connected to the other or to you in any way that would affect their objectivity. Making a written request. You must sign a written request that says you want to have a medically assisted death that must include your signature confirming your request for medical assistance in dying. If you can't write, another adult can sign the request on your behalf under your clear direction. The adult must be at least 18 years of age, understand what it means to request medical assistance in dying, not benefit from your death. For example, they must not be an heir to your estate. 2. Written request must be signed and dated before one independent witness, who must also sign and date the request. Some provinces and territories may have specific request form for you to complete. You can get this form from your healthcare provided for your provincial or territorial government website. Independent witness. The role of the independent witness is to confirm 1. The signing and dating of the request by the person requesting medical assistance in dying, that the person requesting medical assistance in dying understands what they are signing. An independent witness must be 18 years of age, can be a paid professional or healthcare worker, must understand what it means to request medical assistance in dying. To be considered independent, independent means that the witness cannot benefit from your death, be an unpaid caregiver, be an owner or operator of healthcare facility where you live or are receiving care. Withdrawing your request. You must be informed of your right to withdraw your request for medical assistance in dying at any time in any manner. You do not have to proceed even if you're found eligible for this service. Final consent. Immediately before receiving medical assistance in dying, you must be given the opportunity to withdraw your consent, affirm your consent if you do not wish to withdraw it. An exception to this requirement is possible if you have a waiver of final consent. You can waive the requirement to provide consent just before you receive medical assistance in dying, only if your natural death is reasonably foreseeable and, while you had decision-making capacity, you were assessed and approved to receive medical assistance in dying, your practitioner advised that you are at risk of losing capacity to provide final consent. You made a written arrangement with your practitioner to provide consent in advance on your chosen date if you no longer have the capacity to consent on that date. Any arrangement of the waiver of final consent will be considered invalid if, at the time that you were to receive medical assistance or dying, you no longer have capacity and demonstrate refusal or resistance to the administration of MAiD by words, sounds, or gestures. Reflexes and other types of involuntary movements do not constitute refusal or resistance. Examples of involuntary movements include responses to touch or the insertion of a needle. Advance consent in cases of self-administered medical assistance in dying. You can make a written arrangement with your practitioner so that they can administer medical assistance in dying in the event of a failed self-administration. This arrangement allows for clinician-administered medical assistance in dying if there are complications during self-administration that cause your loss of decision-making capacity but not your death. This means that your medical practitioner must be present at the time that you are self-administering the medications. Requests, hey, Jumbo, when you get a chance, swing back in. If you think these things are weak safeguards, I'd like to know your reasoning why, and I'd like to know what you'd be interested in adding, if you get a hot minute. I'd be curious to know your thoughts. Request where your natural death is not reasonably foreseeable. If the medical practitioner assessing your request for MAiD determined that your death was not reasonably foreseeable, there are extra safeguards that must be met before medical assistance in dying can be provided. 1. One of the two medical practitioners who provides an assessment must have expertise in the medical condition that is causing your unbearable suffering. If neither of them have this expertise, they must consult another practitioner with expertise in the medical condition during the assessment process. 2, you must be informed of available means to relieve your suffering and offered consultations with professionals who provide services, including where appropriate, palliative care, community services, counseling, mental health and disability support services. 3, you and your practitioners must have discussed reasonable and available means to relieve your suffering and all agree that you have seriously considered those means. 4, your eligibility assessment must take a minimum of 90 days unless the assessment has been completed sooner and you are at immediate risk of losing your capacity to consent. 5, immediately before you receive medical assistance in dying, the practitioner must give you an opportunity to withdraw your consent, ensure that you give express consent to receive medical assistance in dying. We're almost done. And then we'll discuss more. PNC brings up a good point. Medical practitioners, those who can conduct assessment and provide medical assistance in dying, are physicians, nurse practitioners in provinces where this is allowed. Those who can help provide medical assistance in dying includes pharmacists, pharmacy technicians and assistants, family members or other people that you ask to help, healthcare providers who help physicians or nurse practitioners. These people can assist in the process without being charged under criminal law. However, physicians, nurses, practitioners, and other people who are directly involved must follow the rules set out of the criminal code, applicable provincial and territorial health-related laws, rules, and policies. Providers' rights. Not all healthcare providers are comfortable with medical assistance in dying. Federal legislation does not force anyone to provide or help to provide medical assistance in dying. Provincial and territory governments are responsible for determining how and where to provide healthcare services. They may also make policies around where medical assistance in dying can take place. However, they cannot permit actions that are prohibited under the criminal code. Supporting access. We understand that these providers' rights could create challenges if you want to access medical assistance in dying. Contact your healthcare provider for questions about access. You can also contact your province or territory for information on the procedure and other care options. If you're a healthcare provider, contact your provincial or territorial professional regulatory body for information about your reporting obligations, specific practice guidelines, and learn more at the related links.